Hello. We'd like to begin our presentation today by thanking you for the opportunity to impact the professional growth and development of the nursing clinicians at your rural health clinic. We've come to understand the challenges of your nurses and nurse practitioners in finding opportunities that will give them the confidence in their practice and the resources needed in today's healthcare delivery setting, regardless of where they practice. My colleagues and I have created a presentation that we hope you will find as dynamic and engaging as our proposed solution. Our goal is to help you transform education delivery, creating a partnership for knowledge management and knowledge delivery. We feel confident that our proposed solution will enhance and improve clinical practice by utilizing mobile technology. Based on our research and in speaking with the nurses at your clinic, we have found that the lack of professional development and opportunities for expanding knowledge serve as a deterrent not only for practicing in rural areas in general, but to keep them there. Isolated rural areas seem to limit professional networking and participation in continuing education events and activities. Both the nurses and the nurse practitioners report they had insufficient evidence-based resources to validate their clinical care decision-making and to ensure that they were providing safe and quality delivery of patient care. You don't need us to tell you that the services that your clinic provides are vital to the overall health and well-being of your community. You are a portion of the nearly 50 million people that live in remote areas. The people in your community suffer from more chronic illnesses and are more likely to be uninsured. They are older, poorer, and have had fewer physicians to provide primary care. So the registered nurses and nurse practitioners at your clinic are filling in a void for the provision of healthcare services in your community. We know that the nurses and the nurse practitioners are dedicated and devoted. And it's important to reference that they are in short supply and there is a huge demand. Even with 18% of all nurse practitioners practicing in areas of 25,000 people or less, there is a need for more. The aging workforce impacts rural areas as well. The average age of the registered nurse is older than 55. We need to make sure that we recruit and retain qualified clinicians that are ready, willing, and able to provide health care to the members of your community. So this takes us back to the problem at hand. We know that nurses and nurse practitioners are vital components of the community, that they require professional competence and development, and that their recruitment and retention are challenged by limited resources. So despite their overall job satisfaction, the lack of opportunity for professional development and continuing education places a burden on them. Our solution is a prescription for the innovative use of technology. And what must this technology be? It must be easy to use, easy to access, up-to-date, user-friendly, and cost-effective. What should it have and what should it do? Well, it should be all-inclusive, not only provide clinician role and professional development, but also aid and assist in providing population-specific and focused patient care. The populations in your community include the elderly, chronic care, low income, and families across the lifespan. So our solution should incorporate all of these things. The way we see it, you have two options: avoid technology or embrace it. If you avoid technology, you're left to doing exactly what you're currently in the position of doing: driving or flying to conferences, which is expensive. Not only that, it removes the clinicians from the community and the healthcare services stop. Subscriptions to print journals and mailing in for CE credits are helpful. It's a possible solution. And we could even consider hiring educators to come out to the clinic and provide in-person opportunities. But closing the clinics for education days on site means that no one is available to provide services that day. So if we embrace technology, utilize the internet, implement mobile technology, and provide access to distance learning and education, we will be able to maximize clinician time. Our solution: partner with Hospital U. By using the internet, either wireless, broadband, or digital, in conjunction with a PC or Mac computer, your clinicians will have access to a portal and to the resources on the internet that have been gathered, assessed, evaluated, and procured by the individual team at Hospital U. In addition, mobile technology makes the information easily accessible and portable. Devices like the iPod Nano, the iTouch, the iPad, and the iPod Shuffle are all used in this program, and they are capable of downloading audio and video. But perhaps the most impressive feature are the apps or applications. Programs like Epocrates, video reference channels, advanced life support algorithms, medical references, all of these are available in your hand in real time without access needed to the internet. These are downloaded and prefabricated to your specifications. These apps can be used for reference, for resource, and for guidelines. Videos can also be downloaded. There are pre-recorded videos, there are videos that can be purchased, and you can custom record. Keeping clinicians up to date requires a lot of work, but Hospital U has a process for ensuring that not only are the latest and greatest videos up to date, but that they are accessible and that they have been reviewed and selected for those that have been received the highest evaluation from peer review. There are 3 points to ponder. Challenges to technology. What is your internet access and capability currently? Funding. How are we going to pay for this? And utilization. Are the nurses and nurse practitioners going to use it? We would recommend the following. First, let's make the decision to move forward. Then, let's take a look at what we have to work with. What's our internet connectivity? Let's contact Hospital U, see what resources they have to help plan and develop our project, contacts and assistance that they have with grants, grant funding, and grant projects. And we have the opportunity to look for funding through federal, state, and local government opportunities, those provided in the Healthcare Reform Act, the Robert Wood Johnson Foundation. NIH has been instrumental in supporting other pilot projects using Hospital U technology. There may be donations available, people may want to contribute on their own, and we always have the private sector and businesses in the community to consider asking for assistance. We would then need to purchase the hardware. We would do so at a discount price, and those clinicians that already have the hardware can have the information uploaded onto their own device, which is nice because then they have it whenever they need it. We then provide whatever devices we purchase to the nurses and nurse practitioners. And really the only ongoing training is for them to get comfortable with it, to utilize it, and to figure out a plan for how the devices are going to stay updated. Do you take 2 and send them in to get re-imaged and re-downloaded or re-apped, for lack of a better word, and have backups, and how do you do that on a cycle? But that is something that I think is relatively easy to overcome. This will provide you with an outstanding experience and the support that you need. How will you know it worked? That's always important. We would suggest that you use a 5-minute survey looking at who's using it, how often they're using it, what applications are they using, and what are the clinical outcomes as a result. The survey should also include some qualitative questions, including satisfaction with the technology, the resources, both for continuing ed and also evidence-based clinical decision-making. And then the aggregated data could then be used for continuation of funding as well as additional grant opportunities. We have truly enjoyed working on this project. We thank you for your time and attention, and we look forward to bringing this innovative use of technology to life.